Hi, welcome back to Surgical Non-Surgical Showdown. I'm Dr. Jordan Rahani,
I'm Madison, nurse practitioner and injector at the Facial Plastic Surgery Institute.
and today we're going to be looking at patient photos. We're going to be discussing options for the patient, what I would do surgically, and then what Madison would do non-surgically. All right, so we have another patient here. This patient is coming in, let's say, for changes that she's noticed in her lower eyelids and lower face. Why don't you go through your algorithm on this patient? Let's say that she wasn't interested in surgery, what you would be able to offer her.
So on this patient, I am noticing that she's got a fat pad herniation underneath her eyes there. She also has some loss of volume in her midface, the lateral and medial cheek. She's got prominent nasolabial folds, prominent prejaw sulcus, as well as jowling and some flattening in the preauricular area. So as far as my treatment plan for this patient, she's got global volume loss. So I'd like to start her on Sculptra to build back some of her collagen and kind of support her preauricular area as well as her like jawline. But since she has quite a bit of volume loss, I'd probably need to go in with hyaluronic acid as well. I'd want to support her lower eyelid complex. So support her with some medial cheek and lateral cheek hyaluronic acid and very, very conservative tear trough HA as well, given that she has lower eyelid laxity, and then finishing out with nasolabial folds and marionette lines and prejaw sulcus.
Okay, so it sounds like you're going to be volumizing the midface, lateral cheek. You're going to be doing this base layer of Sculptra and the preauricular, prejowl, something that's going to give or allow her to build her own collagen gradually over time. But what's this patient's expectations, or what's your expectations in terms of creating a sharper jawline for this patient?
So in terms of her jawline, I would let her know that, like, obviously I'm not taking any skin out. I'm really just adding volume where there's volume deficit to give the illusion or the appearance of a sharper jawline.
So surgically, from a standpoint of lower eyelids, mid-face, lower face, this is really going to be me trying to create smoother contours all around. And so when it comes to the lower eyelids, performing a lower blepharoplasty, that's going to allow me to address those fat pads that are starting to herniate out, or the pseudo herniation of fat of the lower eyelids. And then we're actually going to be picking up those fat pads that create the nasolabial folds and the jowls. So we can actually pick those up and reposition, obviously tightening the neck as well to create a sharper jawline. And that's all done through a lower face and neck lift, lower blepharoplasty. All right, so that's a recap on this patient. Obviously, this patient has challenges when we start getting into fillers. How many syringes would you say that you're probably going to use, or what's your
Gosh,
treatment plan?
like 6 vials of Sculptra and 6 or more syringes of HA filler.
And so a patient who's coming in, let's say for a liquid facelift, you're going to be using these higher volumes of HA filler, and those are things that you're going to have to, basically be doing every year to some degree. And so
Definitely.
the approaches are very different. Madison's trying to create smoother light contours. She's trying to volumize in areas that need volume to create more of the illusions of sharper jawlines, diminished fat pads, etc. Versus doing what we do surgically, where we're moving things, kind of back to their native positions. So very different approaches. Some solutions are better for certain patients. Some patients that are ready to take the leap surgically, then that could be a better option for them as well. But you get an idea of kind of the different approaches that we take when we evaluate a face here at the Facial Plastic Surgery Institute. I hope that was informative. Let us know if you have any questions. Thanks.